All right, he was talking about the Sterlite protests there, but let's take a look at the COVID situation in the country currently. Amid rise in COVID-19 cases in India, Union Health Minister Mansukh Mandaviya will today chair a high-level meet to review the situation. The health ministers of all states and union territories will participate in the meeting. Empowered Group and National Technical Advisory Group on Immunization officials will also attend the meeting. This comes as India recorded more than 6,000 fresh COVID cases over the last 24 hours. The COVID-19 cases in India have seen an upward trend in the past few days, with the daily fresh infections increasing every day. All right, let's go across to my colleague Sherine Elizabeth, who joins us on this broadcast. Sherine, that high-level meeting today, what decisions can we expect to be made? And also, I'm sure a lot of people curious, will that mask mandate come back?
Well, this has in fact been a number of times asked to the Health Ministry whether the mask mandate and other guidelines that are in place will be made mandatory or not. But the Health Ministry at the moment maintains that according to the data that is available with the experts in the country, it is believed that the sub-variant of Omicron, which is XBB.1.1.6, which is doing the rounds in the country at the moment, which is infecting a lot of people at the moment, is transmissible, but at the same time it is not severe in nature. That means that people don't need hospitalization. People with proper home care are in fact getting well in about 3 to 4 days. So keeping that in mind, of course, no mandatory, no protocol or no guidelines are going to be made mandatory at the moment. But at the same time, all the states have been advised to ensure that the test, tracking and vaccinating happens at in fact a steady pace. Because we are seeing, as far as the precaution dose is concerned, that stands at 27%. Hence, that needs to be increased, is what the Health Ministry has been saying. Now, today the meeting is going to be on two main agendas. Of course, the tracking, testing and vaccinating. Apart from that, what is really the ground situation? What is the positivity rate? Because around 8 states in the country are reporting over 10% of weekly positivity rate. So that is, of course, a concerning situation. Apart from that, on April 10th and 11th, there is going to be a mock drill that is going to be conducted across the country. So the nitty-gritties of that will, in fact, be discussed in the meeting, how all the states have to follow the SOPs and ensure that the mock drill happens and is successful. The aim of the mock drill is to ensure that the entire hospital or medical system in the country is well equipped to ensure that the infection, in case it goes off hand, is well equipped to handle the situation. So these are the two main agendas with which the Health Minister will be meeting all the stakeholders. That includes the health ministers of all the states and also the health secretaries.